ACEs, or adverse childhood experiences, are stressful or traumatic events that occur during childhood. These events can have a profound impact on a person's physical and mental health throughout their life. There are 10 ACEs that have been identified by researchers, including abuse, which can be physical, emotional, or sexual, neglect, which can be physical or emotional, and household dysfunction, seen as substance abuse, mental illness, or domestic violence. In high doses, exposures to childhood trauma can affect brain development, the immune system, and the hormone system, also known as the endocrine system. In some cases, it can even affect the way that our DNA is read and transcribed. Studies have shown that individuals who experience ACEs are more likely to develop chronic health conditions, such as heart disease, obesity, and diabetes. In fact, high exposure to trauma and ACE-related experiences can actually triple lifetime risk of heart disease and lung cancer. It can cause up to a 20-year difference in life expectancy. Children who experience ACEs are also at a higher risk for mental health problems, including anxiety, depression, and PTSD. Additionally, these individuals may have difficulty forming healthy relationships and achieving success in work or school. It's important to note that ACEs can affect anyone, regardless of their race, gender, or socioeconomic status. However, certain groups may be more vulnerable to experiencing ACEs, such as children living in poverty or those with parents who struggle with addiction. Children are especially sensitive to ACEs because their brains and bodies are still developing. One especially important scientific finding is the dose-response relationship between ACE scores and health outcomes. As seen in literature published today, the higher the ACE score, the more negative health outcomes a child is at risk for or develops as they age into adulthood, even when the original threat or source of trauma is eliminated from their life. Preventing ACEs and supporting individuals who have experienced them is crucial for promoting overall health and well-being. Strategies for preventing ACEs include promoting safe and nurturing relationships between caregivers and children, providing access to mental health services, and addressing underlying social and economic issues such as poverty and inequality. Changing social norms, providing access to quality childcare and education early in life, and enhancing parenting skills on a community level can also serve as effective strategies for preventing ACEs. Screening children for ACEs early on can allow for early intervention and a more accelerated and supported healing process. In conclusion, ACEs are a significant public health issue that can have long-lasting effects on an individual's physical and mental health. As stated by Robert Bloch, the former president of the American Academy of Pediatrics, ACEs are the single greatest unaddressed public health threat facing our nation today. By understanding the impact of ACEs and implementing strategies to prevent them, we can create healthier and more resilient communities.